Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have our friend Dr. David Geier. He's an orthopedic surgeon and a sports medicine specialist at East Cooper Medical Center. First off, thanks for being here with us today. I know
absolutely.
You're a busy guy.
Thanks for having us.
All right, so we're going to talk about the partnership y'all have with Lucy Beckham High School. But first off, just kind of give people an overview of what you do.
I'm an orthopedic surgeon and I specialize in sports medicine, which is not just high school athletes. It's athletes, but also active people. So adults and young kids that just want to exercise or play sports, and they get
like
aches
me.
and pains.
I came
Absolutely.
to see him.
Yeah, so they
Miracle
get
worker.
aches and pains, they get real injuries, and that's what I do.
Alrighty, well, talk about kind of how you got involved with this partnership. I mean, it's a big deal.
Yeah, the hospital administration, in coordination with me and Amelia and a lot of people, kind of came together to identify a need and fill it. They needed somebody that, medical providers that could be there at their sporting events, could be at their practices and in the training rooms every day to evaluate injuries, and then obviously we'd take care of them. And then obviously, you know, from our standpoint, it's a good relationship for the town of Mount Pleasant.
Okay, so you're all over the place on social media and things like that, so we'll have to put your following or handle on this so that people can, because you got a lot of interesting things that you're doing all across the low country. So I want to talk about, though, your expert opinion on kind of how those injuries may have evolved since, you know, I played sports forever ago. We didn't have this type of luxury of having, you know, people like you and Amelia and your whole team helping with our injuries. Are you seeing more serious injuries, or are they typically like they have always been?
On one hand, they are more serious. The athletes are bigger, they're faster, they're stronger than ever before. So there's more impact, there's more, you know, these non-contact injuries, there's more force when they turn because they're bigger and stronger. Having said that, our ability to identify them and treat them is much better. You know, 20 years ago, we didn't have MRI. So we would just say, oh, it's just a sprain. And then these people, you see them now when they're 50 and they've got bone-on-bone knee arthritis. So the ability to diagnose these injuries earlier and quicker and make the right decision as far as treatments, and then the better rehab is light years better than what it is. So we're sort of chasing a moving target, but all in all, the care of athletes is much better.
And what I know from my experience working with you when I came to see you about my back, you're really big on looking at the big picture. You're not gonna just write a prescription or anything like that, because I mean, let's be honest, that's a big issue nowadays with just getting a prescription, and that's causing addiction and things like that. I was really impressed with how you want to look at other options like rehab and things like that, right?
On one hand, you want to do everything you can to avoid surgery. Not always possible, but you'd like to. And yes, you absolutely want to avoid just Band-Aid sort of treatments, pain medicines and that kind of thing. But you also don't want to just treat an injury. You want to try to prevent it from happening again. And so that really gets to the whole encompassing nature of athletes' care is to, you know, they need to be able to play. They need to be able to run up and down the field and tackle, you know, at full speed and do everything at 100%. So if they're at 80%, they're more risk to get hurt. So our goal is not only just to treat their initial injury, but make it less likely that they need us in the future.
And you're such a great communicator, so talk about like your interaction with the parents.
I feel like that's one of the things that both Amelia and Katie, our athletic trainers here, and that I do fairly well, is we try to explain information in ways that they can understand. Injuries are scary. When your knee is big and swollen and you can't put weight on it, or you can't lift your arm, you're worried you're not going to be able to play the rest of the season, or am I even going to be able to go to school, you know, and do that normally. So to be able to explain information in ways that people understand what their injury is and they know exactly what's going to be involved in getting that young athlete better, it makes for a better communication, better understanding, and a better comfort level for the family.
So let's say a kid gets hurt. What advice would you give to the parent and everything about listening to those complaints, or kind of making sure they're monitoring their progress?
It's always a good idea for the young athlete, and parents really need to stress to their child, go get it checked out. Amelia's here every day. She's at all the practices, is in the training room. It very likely may be, it's just a bruise, no big deal. It may need tape or ice or something like that, but sometimes it's not. And the earlier you catch some of these injuries, sometimes you can avoid a surgery or avoid a recurrent injury that turns something that could have been a few days into a few weeks or an entire season.
Well, and can get really expensive, right? You
That
think
too.
about that. Okay, so if I'm going to another high school and stuff, but I want to come see you. What do I do?
Yeah, yes, we have a relationship with the high school,
Yes,
and they send
but
people
you
to us,
are
but we
obviously
take
at
care
East
of people all over town, all high schools, colleges, and then, like I said,
women
adults.
like me. That's what I,
Stuff. So absolutely, they're welcome to come see us. Our website, you can certainly reach out to us there. Get in touch with us, like you say, online. There's various ways to communicate with us. We'll get you in as soon as we possibly can, both either with me or our other types of orthopedic specialists,
You got a
or
great team.
non-orthopedic people, physical therapy, primary care doctors,
Yes.
things like that, to try to get you seen as soon as possible and get you back to what you love to do.
Alrighty, well, thank you so much again for coming out here and joining us on this beautiful day. I appreciate
Thank
it.
you.
And for more information, of course, you can always head online to eastcoopermedctr.com.